Committee substitute for Senate Bill 844, a bill to be entitled, An Act Relating to Sickle Cell Disease Care, Management, and Treatment, Continuing Education.
The Senator of the 34th, Senator Jones, you are recognized to explain the bill.
Thank you so much, Mr. President. Good afternoon, members. Members, sickle cell disease affects hemoglobin, which is the major protein that carries oxygen in red blood cells. Normally, red blood cells are disc-shaped and flexible, allowing them to move easily through blood vessels. In sickle cell disease, red blood cells are misshaped, typically crescent or sickle, shaped due to a gene mutation that affects the hemoglobin molecule. When red blood cells sickle, they do not bend or move easily and can block blood flow to the rest of the body. According to the National Heart, Lung, and Blood Institute, 100,000 people in the United States and 8 million people worldwide are affected by sickle cell disease. 90% of people who have sickle cell disease are non-Hispanic, Black, or African American, with about 1 in 13 Black babies being born with the sickle cell trait. Individuals with sickle cell disease routinely report delayed care, inadequate pain management, and provider bias, particularly in emergency care settings. While there are doctors who specialize in sickle cell disease, many healthcare professionals receive little to no formal training on sickle cell disease, which leads to mismanagement of pain and preventable complications. SB 844 updates Florida law to ensure that education on sickle cell disease is included in both controlled substance prescribing education and initial licensure renewal requirements for certain healthcare professionals. Licensed physicians and nurses must complete a one-time, 2-hour board-approved continuing education course on sickle cell disease care management as part of their first license or certification renewal. The course must cover, but is not limited to, evidence-based treatment protocols for patients of all ages, continuing patient and family education, periodic comprehensive evaluations and other disease-specific health maintenance services, psychosocial care, genetic counseling, and pain management. And that is the bill, Mr. President.
Are there amendments?
None on the desk, Mr. President.
Are there questions on the bill? Senator of the 34th, Senator Jones, moves the bill be read a third time. All those in favor of the motion signify by saying yea. All those opposed, show the motion passes. Please read the bill a third time.
Committee substitute for Senate Bill 844, a bill to be entitled, An Act Relating to Sickle Cell Disease Care, Management, and Treatment, Continuing Education.
Is there debate? Senator of the 34th, Senator Jones, you are recognized to close.
Thank you so much, Mr. President. I do want to just publicly thank Senator Colleen, Chair Burton, Chair Trumbull, Chair Grugers. They allow me to, thank you. That's Senator Trumbull. He's making trouble over here in the corner, guys. But thank you all for hearing my bill. But I also wanted to give a shout out to Kimba Gossier, who is the CEO for ASAP. She's from my district. And Mr. President, she came up and you all saw her and her son and the people she brought up, who she called the Sickle Cell Warriors. She traveled up here every week until this bill was heard, and she couldn't be here today, but I'm sure she's watching. And Kimba, from the entire Senate, we thank you for your advocacy for all the sickle cell warriors across the state of Florida, and I hope I can get your all's favorable support. Thank you, Mr. President.
Secretary will unlock the board, and senators will proceed to vote. Have all senators voted? Secretary will lock the board and record the vote.
37 yeas, 0 nays, Mr. President.
Show the bill passes. Please read the next bill.
Committee substitute for Senate Bill 1014, a bill to be entitled, An Act Relating to the Provision